Sir, I'll start.
Yes, madam. Yes, madam.
Okay, sir. Thank you so much. Good evening, friends. Before we start the session, I would like to pay respect to our late Shri MP Khemka sir and Shri JP Agarwal sir ji and take blessings from God, our parents and teachers. So today we are going to learn about the urine examination. So urine is something really very, very important because it tells us about the internal environment of a person, right? So I'm sure like most of you, I mean, like if you have suffered any time from any disease, you must have undergone the urine examination. So generally, like, these things are not told, but the urine examination, generally what we were taught in the college time, you are supposed to give the first urine of the day. So after you wake up, like anytime after 3:30 a.m. in the morning, so the first sample, whatever it is, you should give. So generally, like it is that the first part of it, you have to let it go, and the second part is to be collected, and the third part again it has to it is not taken. So that is how you collect it in a sterile bulb. So they call this whatever the bottle or something where we collect the sample. So it should be a sterile one. So generally, it is a good thing that you should ask the patient to take it from the laboratory, because they always keep those sterile bulbs there, and the patient can directly give in that, and they write the name and they take it. Now, before we go ahead to how do we know what is the normal urine? Normally, how many times a day one should urinate? Any idea?
5 to 6 times.
5 to 6 times?
5 to
Everybody
6
agrees?
times.
For female, 5 to 6. For male, 6 to 8.
No, for males it is 4 to 5 only.
Okay.
And for females it is 5 to 6 times. Okay. See, males, they have more stronger muscles. So they have more holding capacity also. So that is the reason, like, males generally go less frequently. And if you collect it in a glass, how it should look? The urine, how it should look?
It should
Pale
be
yellow.
It should be
Pale
it should
yellow.
be
pale
plain.
yellow.
Pale
Okay.
yellow.
What else?
It should not
No
be
granules of
Yeah.
blood
No
or something
granules.
like that.
Yes, it
There
has to
should
be
be
clear.
no reddish color.
Yes, it has to be pale yellow or straw colored. And like if you hold a paper against it, it should be clearly visible. Okay, there should not be anything. So definitely, each one of us, we should do it every week, like, so there are no abnormalities in the urine. So we should definitely do it. Before we now go ahead, we should know what else is there in the urine. So if we see this urine examination, so our kidneys, it is a part of a excretory system, right? So both the kidneys are there, which function non-stop 24/7. And see, every minute how much blood is filtering? 1200 ml per minute. Okay, so this is total of the 1/4 of the total cardiac output. So daily 1728 liters of blood, it is filtered by the kidneys. So if we see this, how much blood it is filtering, in this 128 plus minus 2 ml of fluid, that is without the blood cells and the plasma proteins, it is getting filtered by each kidney per minute. So how much is that? Per minute it is filtering 1200 ml of the blood, and in that there is 128 ml of fluid, which the fluid is getting filtered. So per day, if we see, 180 liters of fluid is filtered, and this fluid which is getting filtered, it is called as the ultrafiltrate. Okay, now this ultrafiltrate, it goes through the nephrons, and we all know that the kidney reabsorbs all the useful substances. What are those useful substances which kidney reabsorbs? Does kidney reabsorb anything or not?
sodium.
Sodium,
Yes.
What else? Yeah.
Acid.
What?
Calcium.
Somebody is saying, but I cannot hear it. The voice is not clear.
Calcium chloride, potassium.
Okay. What else? The main things what it is absorbing back?
Water.
Water. Yes. What else? Water. Somebody said sodium. And the third something very important thing.
Calcium.
No, not
Ketone,
calcium.
Potassium.
Protein में
Glucose. Glucose.
Glucose, yes.
Okay, so now this is reabsorbing all these useful substances. So every day out of this 180 liters, 1.52 plus minus 0.3 liters is excreted every day, and we call it as urine, right? Now this urine, it contains substances which are present in excess in the blood, useful or not useful. Okay, so whatever is excess in the body, it will just excrete it. So like suppose if you eat lots of sweet things, today is your birthday and you had lots of jalebis, so extra sugar in your body, yes, it will be excreted through the urine because it is extra in amount. So whatever it needs, it will take, and rest it will just excrete it. So whenever you go for a test, you should see that you are not taking anything extra, whatever it is, maybe salt or anything in excess, like whatever you I mean, like very hot things like the chili or the pepper or sweets you should not have before going to the urine examination. So generally, if we see, this urine test is done along with the blood test. Okay, and it is helpful for what purpose? So it is helpful to diagnose any urinary problems are there, or if any kidney problems are there, or any excretory system diseases are there. It is it helps to diagnose that. Now, if we see this, what is the normal? We should know all this. In fact, like, there are 17 of these things which Dr. G.C. Agarwal, he has put them in the Parikshan book. We all should know that how much should be the volume. It should be 1.5 to plus minus 0.3 liters per day. Color should be light amber yellow color. Smell should be ammonical. Okay, slight ammonical. So if someone says there is no smell to my urine, that is also not good. There should be no deposits. Okay, and the specific gravity, it has to be 1.015 to 1.025. Now here, let me tell you, the specific gravity of water is 1. So this is little more, the density of the urine is more, and the pH is acidic. See here now, this I want you all to remember, this pH is acidic, it is 5 to 7. Nowadays, the labs say that it can be 5 to 8, but no, 5 to 7 is ideal, because if it is more alkaline, it can have more infection. Okay, so pH should be always between 5 to 7, and there can be albumin traces, there can be sugar traces, there can be ketones. If someone is diabetic or something, they can be there. And their urea, it is excreted 25 to 30 milligram per day. Then some amount of uric acid is also there, some amount of creatinine is there, sodium is there, potassium, calcium, chloride, and phosphate. So whatever these levels mentioned here, they can be there in the urine, right? And besides that, what else is seen in the urine? So if the microscopic examination is carried out, it is you can see few crystals, you can see some casts, some erythrocytes, that is the RBCs, leukocytes, that are the WBCs, and some bacteria if there is any infection. Okay, so now if we see the color of the urine, what it is amber color or straw colored. Now here if we see, if the urine is cloudy, why it would be cloudy? It can be cloudy because of the crystals, or if there are some deposits present there, or if there is some infection, or they can be reddish brown because of the RBCs, or if there is lots of hemolysis taking place because of that, or it can be brownish yellow because of the increased hemolytic disease. And if it is milky, it can be chyluria, that is the fat can be seen in here. So the color is something very, very important to note. Then coming to the volume. Now, how much is the volume? We have seen it is 1.5 to 2 liters. And what happens if somebody is peeing more? it will, if it is more, it can be because of diabetes insipidus. What is diabetes insipidus? You all know? Is it same as diabetes mellitus?
No, ma'am.
Glucose is
No?
secreted by urine, not in blood. Is in blood, glucose is normal. In urine, it is excess. It's a
I would like you all
genetical
to go and
problem.
refer to it again. Okay, diabetes insipidus and diabetes mellitus, they are totally different conditions. In diabetic insipidus, lots of urination is present. Okay, and because of diabetes mellitus also there is increased volume of urination. Then if someone is using diuretic medicines, so diuretic is what? It is making excess urine. It is throwing lots of fluid out of your body. So that is diuretic. Alcohol excess. Alcohol also, but beer is the one which increases the urination. And in case of cardiac failure also, it is more. And if we see here, if it is the urination is less, it can be because of the dehydration. If you're not drinking enough water or there is lots of heat outside, because of that also your body is getting dehydrated. Or if you have lots of fever, high grade fever, so dehydration is taking place, and because of that the urine volume is less. It can be because of hemorrhage, because there is lots of blood loss. Then it can be shock, obstructive causes of prostatic and ureteric calculi, and also in glomerular nephritis. So now if you see here the color of the urine, see, you should always take it in a glass, the urine, glass. And if you see here, this is the volume. Always you will see at the base, there is some deposits you will be able to see, and you can even smell it. So odor will be there. So if you classify the urination, if it is less than 100 ml, this is anuria. What is anuria? No urine formation is there. So it is less than 100 ml. And many times this takes place after the surgery, that patient is not able to pass urine, or the urine formation is less. Then oligouria, it is less than 400 ml per day. So this is the less urination taking place here. And polyuria is what? If the patient is peeing a lot, 2 liters per day. So the patient tells you, I drink less water, but I urinate a lot. This is the common thing the patient will tell you. And now if you see this picture, see, what does your urine contain? It contains urochrome, bile juice, lymph, cholesterol. So I'll just make it a little last so you can see it clearly. See here. Now if you see this color of the urine, this is something very good. So normal, it has not supposed to be white. Okay, it is not white at all. Then this is also good. This is fair, little darkish, and this is lightly dehydrated. Then if you see this color, little dark orangish, it is dehydrated. And if it is complete orange, it is very much dehydrated. And if it is reddish in color, this is definitely severely dehydrated. But yes, we have to consider also whether there is blood in the urine or not. So if you see here, you can see colorless or the pale yellow. This is colorless is not normal. Okay, they have given normal, but it is definitely not normal unless you drink lots of water, and you pee it within 20 minutes after having the water. Then dark yellow, it is concentrated, and if it is green, it will show you some infection. Or methylene blue, if you had some typical food colors or something because of that. Or yellow green or yellow brown, it can be because of the bilirubin or biliverdin, which is present in the blood, excess one, because of that. And red will be because of the RBCs or hemoglobin. And brown black can be because of the methemoglobin. So actually, we are supposed to know what color the urine looks. So daily, I mean, whenever you pee, you should definitely see the color, that what is the color of it. So now in the chapter in the Parikshan, they have given, in abnormal conditions, the urine may be smoky. Okay, so color of the urine is smoky when there is stone in the urinary bladder or ureter, or presence of erythrocyte. If the kidney is damaged, in that case, it will be smoky or reddish brown whenever there is presence of hemoglobin. Then brownish black, it will be because of the melanin pigment present there. or black, it can be because of the iron administration, parenteral iron administration. So somebody is taking injections of iron, in that case it may be black. Or somebody is taking lots of beetroot or medicine known as the rifampicin, in that case the urine can be red in color. I remember one of my teacher telling that one patient had come and he used to say that my urine is red in color. So they performed lot many tests for him, and everything was clear. But then, like, he used to come again week after weeks, like he used to come. And then one day the teacher asked him that they were talking, and he says कि मेरा खेती है करके, तो क्या उगता है खेती में? तो बीट उगता है. So she said, do you have it daily, the beetroot? He said yes. And that was the reason that because of the beetroot consumption, he was having the red colored urination. So you are supposed to ask the patient this also. Okay, so he was asked to not take it the other day, next day, and then he was asked to come on the third day, and the urine was very clear. So this red color urination can be because of the beetroot also. Then pinkish brown, it will show urobilin. That is there can be hemolytic anemia or malaria or beta hemolytic cocci can be there. And greenish yellow can be because of the bile pigment, and cloudy and turbid can be because of the bacteria and leukocytes, phosphates, water, oxalates, and milky can be because of the chylorrhea. Right. Now, if we see about the smell, now I told you that there has to be some smell to it, light smell, ammonical smell. But if it is more, if you see in the public toilets, especially the male toilets, where you can smell from outside only this ammonia odor. This thing, the urine is excreting some form of ammonia. So there is some odor definitely. But if it is in excess, it can show that there is some bacterial activity. And if it is fishy odor, मछली का smell है, so it is showing that there is E. coli in the urine. Now we all know this E. coli, they are present in the stools. So if the care is not taken while washing after the stools, so especially in females, because the anus and the urine holes, they are quite close by, also the vagina. So they can pass from the anus to the urinary bladder, and there they can make their colony. So it will smell fishy odor. Okay, fishy odor will be there. And if it is fruity odor, fruit ke jaisa smell aa raha hai, then it is showing that there is presence of acetone. So this is diabetic ketosis. So actually, if you see, the diabetic patients will always tell you that my urine, it smells fruity. Okay, the fragrance is sweet fragrance. And if it is mousy odor, that is sada hua, jese like some animal is dead. So it can be an inherited disorder of phenylketonuria. And unpleasant odor will be when methyl mercaptan, it is excreted. So when you have this asparagus or lots of cauliflower, especially if it is raw, like, or only lightly sorted, then there can be some unpleasant odor. So you are supposed to ask the patient what he eats. Okay, so if you see now the pH of the urine, we all know it is on the scale of 1 to 14. So this is the acidic. We all know that our urine should be between 5 to 7, and neutral is 7, and alkaline is still 14. Now again, we come back to the slide. See here, we saw the specific gravity. Now the specific gravity also, it has increased when, if there is more vomiting, fever, diarrhea, sweating excessively, UTI, cystitis, glycosuria, renal artery stenosis. I just now told you about the. Now coming to the protein. See, now generally no protein should be seen in the urine, right? So if it is seen, this is the first sign of the kidney disease. Okay, and there can be calculi or massive amounts if seen, they will be because of the nephrotic syndrome. Okay, here this slide is just telling you that how the pH level of the urine is primarily affected. Basically, it is affected by the food we eat. Okay, so if we see, I'll take the questions in the end. I will not take it right now, okay, because we have some shortage of time. So research shows that if a person's diet is high in animal protein and grains, the pH of urine is on the lower side. That is, urine will be more acidic. And if a diet is rich in greens and vegetables such as kale, spinach, celery, it will lead to alkaline urine. Okay, so a balanced diet incorporates legumes, grains, animal plant protein, all these sources, whatever we all know that they keep our metabolism optimum. So in healthy individual, diet is the major factor that affects the urine pH. A diet rich in animal proteins make your urine acidic, and diet rich in greens and veggies will lead to alkaline urine. But now here I would like to talk to you about this pH urination. I had a patient and she had UTI, urinary tract infection, and she was taking some medicines to make it more alkaline. She thought that it was because of the acidic urine, the infection was there. But it is not that. We all know the urine, how much pH is there? It is 5 to 6. More alkaline. More alkaline means what? There will be more bacteria will survive in that thing. So definitely, if your urine pH is acidic, 5 to 7, one will not get UTI. So you are supposed to keep in mind that. Now, causes of acidic urine, they are given very nicely in your book also. Acidosis and metabolic acidosis they have given. So you can just go through the book. Now we come to the albumin or the protein, what we're talking about in the slide. Now see, if this blood, it does not carry excess protein, nor does the body store it. See, there is no protein. How much we need protein in a balanced diet? How much it is?
20%.
20%? You're near close by. It is 15 to 20%. Okay. So actually, like whatever you need on the daily basis for your wear and tear, that much is enough. So body doesn't store this extra protein. And if it has to store, what it will do? It will store it in the form of the fatty acids. Then, so what it will do? The excess protein will get excreted along with the urine. So after rigorous exercise or pregnancy and lactation, excess intake of proteins, postural proteinuria when a person is standing for a long time, then also he tends to excrete the protein from his urine. So in these conditions, it is normal like, but it may be seen in pre-renal conditions. So if there is disease, the pre-renal conditions like fever, cardiac disorders, abdominal tumors, or renal conditions or post-renal conditions where the kidneys are damaged, in that case there can be urine seen in the protein will be seen in the urine. So here again, this is the first sign of the kidney disease we saw. There can be calculi, that is some stone, and there can be any disease relating to the nephrotic syndrome. Then coming to the next one, the glucose. Now, the glucose is also not to be seen in the urine unless you had some extra sweet in the dinner or lunch, or if one is diabetic. So diabetes mellitus, when levels increase above the threshold, it will be known as the renal glycosuria. Just give me. Sorry. So now if we see about the glucose, now glucose, when it will be seen in the urine, when there is some physiological or alimentary glycosuria. As I told you that you had more glucose in your diet, or when you are very nervous or emotional, that time also the message goes from the brain to the liver, and what liver will do, it will just release the glycogen, and glucose will be formed. Or if there is some endocrine glycosuria, some endocrine gland is not working properly, or if there is some renal glycosuria, there is problem with the kidney or the nephrons, that time also we can see that there is more glucose in the urine. Now coming to the ketones. Now what are the ketones? What are ketones? See, they are not supposed to be there, they will present, their presence indicates diabetic ketoacidosis, an indication of severe uncontrolled diabetes, and it may lead to coma and even death. Okay, now this ketones, yeah, they are acetone, hydroxybutyric acid, and acetoacids. They are released when fatty acid oxidation takes place in liver for energy, when the body needs extra energy when glucose is not available. So like during exercise, diabetes, or starvation. So suppose if you're not taking any food, you're starving. So body needs its energy, no? So from where it will get the energy? What it will do? It will do fatty acid oxidation. From the breakdown of the fatty acids, the ketones will develop, and then they will be present in the urine or in the blood. In diabetes also same thing is there. There is glucose, but the cell is not receiving it. So what does the body do? Body will take the do the fatty acid oxidation, and then there will be ketones seen in the urine. Okay, so that is the ketones. Then if you see the urea, now this urea, it is something tissue protein metabolism gives off ammonia, which is converted to urea by liver. So when there is protein metabolism taking place, it is giving off ammonia, and this ammonia has to be released out of the body. How it will be released out of the body? By converting it into urea. Who will do this? The liver will do it. Okay, so urea is something normal, like in little amount, but high levels of urea is seen in high protein metabolism. So if you're taking lots of high protein diet, or if there is dehydration and few diseases like pyelonephritis, prostate hypertrophy, you can see that. And if there is low levels, when it will be seen, if there is some liver failure or some renal disorders, some kidney diseases, in that case you will see that the urea levels are less. Then coming to the next part is the uric acid. You will see uric acid also. Now this uric acid is a chemical when the body breaks down substances called purines. These purines are made sometimes by the body because the body needs it, and they are also in the food, especially in the non-vegetarians. So when this nucleic acid which contains purine, its catabolism gives off uric acid. What is catabolism? It is the breakdown. And so this purine is, when it is broken down, it is excreted into the urine. What? The uric acid. So generally for the uric acid, the treatment is like the doctors say, okay, cut down on your proteins, have less proteins because you are having excess of proteins. Okay, and where does this take place? It takes place in liver, heart muscles, skeletal muscles, in kidneys, spleen, pancreas. So if the increase of uric acid will take place when you have high protein diet, or you're taking some hormones or some medicines, in that case, more uric acid can be seen. So you are supposed to ask the patient, if is he on some medicine or is on a keto diet, you should ask that. Then coming to the creatinine. Now, what is creatinine? It is a waste product that comes from the digestion of protein in the food and normal breakdown of the muscle tissue. And it is filtered through the blood, through the kidneys. Now, if we see this high creatinine level, we know that this is a waste product, right? So it is seen in febrile conditions, muscular dystrophy, thyrotoxicosis, myasthenia gravis, it will be more. And here another word is there, this is creatine. Now, what is creatine? It is the source of energy for the muscles. So creatinine is a waste product, whereas this measures the muscle health, creatine. Then you can also see some oxalic acid. Now, what is an oxalic acid? It is seen in many of the food sources. So human cannot metabolize the oxalic acid. Okay, so it is excreted in the urine as oxalate. So if you see this oxalic acid, it is found in the palak, right? It is seen there, or even arbi leaves, it is seen. So we make it like, we add tomato or some sour things to it, so that it can be excreted well and it doesn't trouble the throat, because it causes itchiness many times. So higher level of urine oxalate may mean that you are at a risk of developing kidney stones. So they might form the stones inside. So it is generally seen in diabetes mellitus, liver diseases. And many times some casts are seen. Now, what are these casts? Casts are some, like moti jaise, it is some sort of pearly thing you can see. It is an epithelial layer, cell layer. So when it is in the cylindrical form, it is indicates nephritis. So casts are not to be seen in the urine. That is something showing that the disease has progressed in front. And then the degenerative epithelial casts are seen in urine tell about the severe nephritis, heart failure, or septicemia. This is that the infection has spread throughout the body. And RBCs or WBCs, along with this cast, it shows the kidney disorders. And if you see some crystals, now what will happen if you have certain elements more in your body? So body has taken up how much it can take, that much it has taken. There is now saturation level. And if it is still there, then it will be excreted through the urine in some shapes. So if you see calcium oxalate, the crystals will look like envelopes. जो आपका लिफाफा होता है ना, उसके जैसे दिखेगा. So actually, like when you have palak paneer, this is a thing like palak, it is giving you oxalate and the calcium from the paneer. So generally, the people who are having this calcium oxalate stones, doctor says don't eat palak paneer. So you can see even the uric acid crystals, they are seen as yellow rectangular shape. And there can be also bacteria present. Presence of bacteria in urine tells about the inflammations. So there can be inflammation. See, this is how the various casts look in the urine. This is the microscopic examination. Now here you can see hyaline with fat, hyaline to fine granular, or this can be waxy material. These are the different types of casts seen in the urine. And in the tubule, they are seen like this in the renal tubules. And if you see here, these crystals, they are the uric acid crystals, the calcium oxalate, the hippuric, the calcium phosphate. So these are the various, even the cholesterol one, you can see here the cholesterol crystals you can see. So various type of crystals can be seen, even the bilirubin crystals. So if it is in excess, it will be seen. Now, how do you see this report? So when you get a urine test done, you get something like this type of a test report. So it will show you the quantity, how much it is, 10 ml, then what is the color, how is the appearance, specific gravity. Now see here, the albumin is present, but only one plus sign. One plus sign means what? 25%. Two plus sign is 50%. And triple plus sign is 75%. So how much it is? So it is something less. So it is okay. The sugar is absent, bile pigments are absent, urobilinogen is normal, reaction is acidic, then acetone, ketone, they are negative, nitrite is negative, then RBCs are absent. But here if you see the pus cells, they are 25 to 30. So this is showing that the patient has got infection. And here if you see, the remark is also that there is some bacilli, bacteria is seen here. So there are epithelial cells 20 to 22, casts are absent, and other findings are nil. So this is how we see the report. So if you see the next report, something similar only it is from the another this thing. So they have given the physical examination, chemical examination, and microscopic examination. So here you can see the volume, color, odor, aspect, deposit. Then chemical examination, it is reaction, how much it is. See, it is alkaline, pH is 8. Then proteins are absent, sugar absent, acetone. This is all the chemical findings. Specific gravity, bilirubin, urobilinogen, blood. And in the microscopic examination, they found pus cells 6 to 8. If they are 2 to 4, generally it is normal. So here also they have said that 0 to 5 is normal. RBCs 4 to 6. So again, it is on the higher level. Epithelial cell is absent, casts absent, crystal absent. Now see, mucus is there. It is plus plus. So 50% mucus is there, and bacteria, cocci and bacilli. So see 3 plus. So this is showing that the 75% bacteria is present there. So clearly this patient has got infection in the urine. So this is how we interpret the urine examination. Okay, any questions now? Otherwise, I will take the question paper for revision.
Ma'am, in some places they say for protein, I think they say nil and absent. Is there a difference between those two? Are they
Yeah,
same?
actually, no, absent is generally if we see proteins, now if you see this, proteins are supposed to be in less amount. So, negative, totally, you are not supposed to see it. So, you are not supposed to find any proteins there. So, absent is like it is not present. But if some condition is there, that some renal disease is there, and still they have not found, then they will write absent.
Okay.
Otherwise, it is nil.
Okay. Thank you.
Ma'am, about the sugar patients, there will be present of glucose more in the urine.
It can be if the patient is taking excess glucose, there it can be seen.
No. Sugar, they tell that sugar patients, no, for them.
Yes,
How
it will
will be
be
the
there.
report?
No, there will be present. No? So actually, like when there is blood glucose also, and when there is urine glucose also, then the diabetes mellitus has gone to the next level definitely, because now it is excreting from the urine also as well as from the blood also. So it is not under control. So whatever the medications being taken or treatment given, it is not enough to control the diabetes.
If ketones is present, compulsory there will be kidney stone or any
No,
kidney.
no. Ketones are, I told you that the cell is not receiving any glucose to make its energy. Okay. If you see here, your cell, each cell of your body, what does it need? It needs glucose. Okay. It needs oxygen. And then what it does is it makes energy, right? This is the way each cell is working, right? Now, if it is not getting any glucose, the cell is hungry. So then now there is no energy being made. This is not present. Then how the body will get its energy? The body will get the energy by doing, it will break down the fatty acids. When the fatty acid is broken down, then the ketones are developed.
Okay, ma'am. Thank you.
Okay.
Ma'am, I have a
Yeah.
question. If like there is a itching in the vagina part someone has, that is the we can say it's a urinary infection. But if there is a like on the vagina wall, every time this cyst is coming, like I can say in Hindi ki foda without the moon, and it becomes painful after 4 5 days. And if it's happening recently, frequently, so is it related to the same urinary infection or this is something else?
No, you need to get it tested. Actually, if there is vaginal itching, it doesn't say that there is infection.
Okay.
It doesn't say. You have to get
It
it
can
checked.
be due to menopause. It can be.
Yes, it can be menopause, because in menopause, many times what happens, the pH of the vagina, it changes. So in that case, our triple warmer 1, 2, 3, they work wonderfully. So even
triple
like,
warmer 1 2 3 sedate ma'am, tone.
no, you have to see the patient and treat accordingly, or you can go with the even method.
Which method?
Even method. You can apply methi or matar.
Where ma'am?
On TW 1, 2, 3.
TW 1 2 3 methi or matar. That is the
Yes.
simplest line.
Yeah, or even many times I have seen, I mean, my observation, that if there is even some liver issue, so because the extra the liver, it encircles the genital area, so that time also you can see the itching in the vagina, but it doesn't always mean that there is some infection. You have to get it checked.
Okay.
Herpes also, herpes patients will always have genital area infected and the mouth infected. So you may want to check for herpes as well.
Yes. If there are some, as Kashish is saying, that there are some abscess or something, foda funsi kuch hai. So yes, is it herpes? Is it, did the patient have some fever before that? And is there any rash? So you are supposed to check it out. Like you have to take a detailed history.
Okay ma'am, thank you so much. मैम मैं बस आपसे ही नहीं मिल पाई कॉन्फ्रेंस में, बाकी सब प्रोफेसर से मिली, आपको ढूंढती रही एंड देन आप निकल गए. नेक्स्ट टाइम आई एम श्योरली गोना मीट यू इन पर्सन.
Definitely.
Thank you so much.
Ma'am, Ma'am, if there is emergency of urine for every time for a person, means the sugar level is high.
No, not necessary. See, there is a urogenital muscles. The diaphragm is there. So even if that is weak, with the when the person is 40 to 50 plus age, in that case, if the muscles become weak, then also there can be urge to pass the urine. In that case, many times SP8 it helps. Even UB54 tonification helps. SP8 also tonification. Or even you can ask the patient to do the exercises of the bladder. So like why I mean the vaginal muscles, you can ask them to hold and contract, or you can also ask the patient to pee and stop in between forcefully. So all these exercises also help a lot.
Ma'am, you told us SP8 and UB54 tone,
Yes,
both.
yes. Or anyone, not both of them. Anyone.
Yes. Anyone. Okay.
Yeah.
Ma'am,
Ma'am,
this
in
is
which
maybe
condition?
because of the spleen deficiency also.
Not necessary. Who controls the lower orifices? Who controls?
Ma'am, even the patient sometimes,
Yes, somebody said kidney. That is the right answer.
Okay. Yes, ma'am.
Kidney controls the lower orifices. So you are supposed to check with the kidney also.
Ma'am, we
Ma'am,
have
if
to
a
just check.
patient, okay, you can. Ma'am, if a patient is complaining, female patient, urge of urine while standing after being every time being seated, after every time she is standing, she urge to urine. So what does it mean?
No, it is telling us clearly spleen key deficiency. The spleen is the one which holds all the organs up, no? So now when she's standing, it is not able to provide support to it. That is why the patient is getting the urge to pee. So you're supposed to treat with the spleen.
Thank you.
मैम
Ma'am, I
SP8 को
wanted to
हमें
ask
क्लासिकल पॉइंट्स पे लगाना है या हमको प्योर मैग्नेट
नहीं
से
कहीं भी
लगाना है
लगा सकते हैं आप. It gives good on the
दोनों
ball
जगह
also. Yeah.
मैम अभी ये जो आपने
थैंक यू
प्रोटोकॉल
सो मच
बताया SP6 को और दूसरा किसी को, वो किसके लिए बताया है मैम?
Urine urgency.
मतलब वो कभी भी होता है तो उसके लिए लगाना है?
नहीं जब भी अभी पेशेंट क्या होता है लाइक पानी पीता है और इमीडिएटली 20 मिनट में उसको ऐसे लगता है कि अभी मुझे यूरिन पास करना है. ही इज नॉट एबल टू होल्ड द यूरिन. सो उसको कि मुझे जल्दी ही जाना है, तो वहां पे मसल्स उसके वीक हो जाते हैं. तो वो इससे SP8 और SP6 नहीं कहा मैंने, SP8 और UB54 एनी वन ऑफ देम इट हेल्प्स. SP8 के मैंने रिजल्ट्स बहुत अच्छे देखे हैं. आई हैव ट्रीटेड माय पेशेंट्स विद SP8.
Ma'am,
Thank you.
sometimes what happens, the patient is not drinking water, but still he is going again and again for the urination, and the amount and the volume is also good. What
Yeah,
is the
so now
meaning
you are
of that?
supposed to find that. See, now I have given you so many clues that kidney looks after the lower orifices. So whether it is yang deficiency of the kidney or yin deficiency of the kidney, so definitely you're supposed to check that. Okay.
Ma'am, so ma'am, this may be because of the kidney yang
It can be
deficiency.
because of the infection also. So you have to check. That's what I said.
Infection is not there. That he has checked. He has get it done.
Yeah.
Infection
So
is not there. So that is maybe because of the kidney yang deficiency.
no, I said we have to check the patient. We have to match the symptoms and treat it. So you
Okay.
take the symptoms and treat accordingly.
Ma'am, I just wanted to ask, like, as I told you about this, that if this is happening like recently and there is no fever, nothing, that particularly I'm asking about that, what kind of, why this, what should we call that cyst type of thing is coming and it's painful after 4-5 days?
No, so maybe it is the heat also. See now, which meridians are going through that area? The liver, kidney, and the spleen is going around, and
Okay.
even the anal canal that is also close by. So, is there any heat in the large intestine? That also you're supposed to check whether the patient is constipated or he has some other problem. So it can
Okay.
show the heat also
It
definitely.
can be
So, ma'am,
metaphysical also.
because it's because the menopause also started, so heat problem is there, the hot flashes are there.
Yes.
So
So
we can give a simple treatment if you can give me simple to just to see what is the result.
you
Just
can go with the distal point SP6 sedation. So that will,
SP6 sedation.
yeah, because that looks after the all
Entire
the genital organs.
Okay.
It is
Aesthetic
the distal
sedation.
point.
Okay. Thank you so much, ma'am. I'll try and I'll let you know.
Definitely.
Ma'am,
And
मुझे
sometimes when we
occurs.
sneeze or cough, there's leakage of urine. Can we apply the same protocol?
Yes, definitely.
Okay, ma'am. Thank you.
But
Ma'am,
also check, whether the patient has some underlying problem. So whether it is spleen key deficiency or some kidney key deficiency also, or I mean, go with the single point, and then if you don't find the result, then go ahead.
Okay, ma'am. Thank you.
Okay.
Ma'am,
मुझे एक
in
चीज
case of skin tags near the genital area, is
I
due
didn't
to infection
I
of
didn't
urine?
understand. I didn't understand.
Skin tags, ma'am. Skin tags will come, no? That populate something we tell. Skin tag.
Not necessarily always. If it goes to the next level, then maybe it can come. So not
No,
always.
it has come means what we should do. Maybe we should tell them to check the urine because
Yeah,
it's
you can
more
ask
in
the
genital.
Yes, you can ask the patient to check the urine, or you can go with the, I mean, symptoms, whatever the symptoms are present.
Sir,
Ma'am,
this condition occurs generally excess heat in the liver also.
Yes, that's what I said. No, you're supposed to match with the symptoms.
Yes.
मैम
Yeah.
यूरिनेशन के टाइम पे अगर झाग आता है यूरिनेशन मतलब आपण मराठीत म्हणतो ना फेस येणं तर जर युरिनेशन च्या वेळेस येत असेल युरिनवर तर म्हणजे ते काय समजायचं आपण
No, actually, see, when there is lots of foaming while urinating, either it is showing severe kidney disorder. Okay.
Yes.
Or it may also show that there is lots of alkalinity. So ask the patient to drink less water, or increase the heat in the body. So that will also help. So, I mean, these two conditions. So you have to see the patient and then treat accordingly. So you just cannot say that, okay, because the
मैम
foam is there,
ये
it is.
यहाँ एक मेरा भी इन्होंने पूछा तो ध्यान है ये झाग कई बार ड्यू टू सम मेडिसिन भी आता है क्या इफ द
Yes,
पर्सन इज
आता है.
टेकिंग
Yes.
मेडिसिन
So that's what I said. Alkaline
urination,
ज्यादा बढ़ गया तो भी आएगा.
ओके
पर अदरवाइज किडनी डिसऑर्डर भी दिखाता है ये.
ओके
वो फॉगी क्लाउडी और स्मोकी में डिफरेंशिएट कैसे करेंगे लाइक रिपोर्ट में तो
इसी
लिखा आ
स्मोकी विल
जाएगा
बी
बट
थोड़ा सा स्मोक कलर का ना, सो वो थोड़ा सा ग्रे कलर के तरफ में जाएगा. फॉगी जो होगा ना तो वो दूधिया कलर का होगा. So actually, then you are supposed to go to the lab and get it checked only, what it is, to see, find out.
मैम एल्कलाइन के यूरिन होने से क्या इम्पैक्ट आएगा अगर इफ द यूरिन इज एल्कलाइन देन व्हाट वुड बी इट्स इम्पैक्ट on our
But there
body?
will be lots of infection there, because in the alkaline environment, the bacteria और virus पनपेगा ना वहाँ पे.
Okay.
So infection होगा.
But ma'am, nowadays the people are saying like the alkaline water pure, so it means that is not good for health.
No, definitely not. Actually, like, I don't know, like, everybody says alkaline, but if you see how much is the pH of your saliva, how much is the pH of your vagina, how much is the pH of your urine, कितना है, acidic है क्या alkaline है?
Acidic.
Acidic है मैम,
Acidic है
saliva
ना.
is also acidic.
हाँ, तो फिर अगर कोई अभी पेशेंट जो है उसको बहुत इन्फ्लेमेशन है, उसको ये सब चीज से बहुत फायदा होगा if he's taking, because there is lots of inflammation. उसका pH 1-2 है तो वो ये अल्कलाइन चीजें लेता है तो उसको फायदा होता है. पर अगर आपका नॉर्मल pH है आपका इसका, एंड आप उसको और अल्कलाइन करोगे, अभी मैंने वही, इसलिए मैंने वो स्लाइड आपको दिखाया कि आप जो फल फूल खाते हो तो उसके कारण आपका pH चेंज हो जाता है ना. सो व्हाट यू ईट आल्सो मैटर्स. या
तो मीन्स मैम इसका मतलब ये हो
I didn't hear
gooseberries
you,
also
Kalpana
because so
ji.
that we can maintain the. Yes ma'am.
I didn't hear you.
Ma'am, it means we should eat this citrus मतलब नींबू का रस and the gooseberries also.
नहीं, सब जो भी मिलता है नॉर्मल बैलेंस डाइट लेना चाहिए. जो हमारे सीजनल फल होते हैं वो ही खाना चाहिए. अगर अभी आप ठंडी में तरबूज खाओगे तो आपको उसका कुछ भी फायदा नहीं मिलेगा. Okay.
Right, right.
And I have one doubt.
Yeah, tell me. Last doubt, then we'll go to the question paper.
Okay. Okay. Ma'am, if person is drinking the beetroot juice every day, she'll get urine in red color. Is it okay or any problem?
No, it is okay. No, that's what I said. Like, that's what I told you. So it is okay. Like, if it is, I mean, but see, anything in excess is bad. So if a person is having lots of beetroot every day, so then it might create some problem. So it should not happen that way.
Okay, thank you,
Ma'am,
ma'am.
one
This
question.
semester we miss you, ma'am.
Ma'am, actually in Bangalore, lot of vegetables are coming without season also.
You
So
should
we
not
don't
have
This is
that.
ma'am, this is
No.
everywhere now. In Gurgaon
Yes.
also, we can get each
No,
and
so
every
that's why
vegetable
I
in all
tell
the seasons.
every student and every patient of mine that you consult your mother-in-law, your mother, your grandmother-in-laws, grandmothers, कि कौन से सीजन में कौन सा फल आता है और वैसे ही आप खाइए. So accordingly, the best thing is celebrate each and every Indian festival what it comes. जो जो आपका एरिया में आता है, so you know accordingly you have those kind of food. Then you hunt for those vegetables and foods also. Okay.
Ma'am, in fact, I
Definitely.
wanted to share my experience about beetroot. Like, मेरे husband को stool के through उसका pigment निकलता था और मुझे urine के through. Then what I added gooseberry in my diet along with cooked that. Then it stopped. That's
Okay.
what,
So yes, Madhvi ji, you can also
not
try out
helped in that
eat
stopped when I
gooseberries
did.
along with the beet. So it's helped her. It might help you also then. Okay. Chalo, let's go to the question paper. So we'll solve the question paper.
मैम just one very small query. किसी का मतलब पैरों का ऑपरेशन हुआ नी का ओल्ड लेडी एंड मुझे पहले का तो नहीं पता बट बिकॉज ऑफ द ऑपरेशन शी इज नॉट राइट नाउ एबल टू वॉक लाइक नाइसली सो उसमें भी और जब यूरिन की फीलिंग आती है तो शी इज नॉट एबल टू कंट्रोल तो आई कैन गिव द सेम पॉइंट विच यू जस्ट सेड अबाउट द यूरिन इमरजेंसी.
Yeah, you can give her because you know she actually उनको बहुत medicines के कारण भी उनको heat भी generate हो सकता है, so you need to check out the condition.
Okay, ma'am. Okay, thank you so much.
And somebody asked me about the alkaline water. Actually, you know, Sri Ravi Shankar ji, know, he always says that like when take a jar of water, उसमें सब आप जो alkaline चीजें आपको डालनी है, नींबू है,
नींबू खीरा,
whatever, like all the things. But then you are supposed to have it only after 2 hours after your lunch or dinner, not before that. Okay. So you can have that, but you know lunch हमारा जब हम करते हैं, so we have HCl, right? HCl वो उसका pH कितना होता है? How much is the pH of HCl?
Ma'am, it is around
1.5 to 2. 1.5 to 2. Okay, so it is needed. नहीं तो आपको हाइपोएसिडिटी हो जाएगा, उसका pH आप बढ़ा दोगे तो वो खाना पचेगा ही नहीं, आपका जठराग्नि सब ठंडा हो जाएगा, है ना? So he says that if you want to have, like if somebody wants to have this alkaline water, you should have only after 2 hours after your lunch or dinner, but not otherwise पूरा दिन में नहीं पीजिए उसको.
बट मैडम अल्कलाइन वाटर ये बनाना बोलते हैं, नींबू तो साइट्रस है ना मैडम, तो अल्कलाइन हो ही नहीं सकता है वो, ओनली खीरा ही अल्कलाइन.
नहीं, नींबू भी होता है क्योंकि जैसे हमारा जो पीएच है तो एक्चुअली नींबू का कुछ सम 3 है उसका पीएच. सो व्हेन इट कम्स इन
एसिडिक है ना मैडम, एसिडिक है ना, पीएच 3
तो वो नहीं, तो वो इससे ज्यादा हो गया ना, HCl से ज्यादा हो गया ना वो. हाँ, इसलिए उसको लेते हैं उसको. किसी किसी को सूट करता है, सभी को नहीं सूट करता है वो.
यस.
मैम इज इट लाइक दैट कि अगर नींबू को अगर सब्जी में डाल के खा रहे हैं देन इट इज नॉट द एसिडिक, बट अगर हम उसको डायरेक्ट खा रहे हैं देन इट कॉज
नहीं, ऐसे तो नहीं है, पर वो नींबू क्यों हम लोग सब्जी में डालते हैं? व्हाई वी पुट दैट? क्यों डालते हैं?
मैम दैट वाज माय नेक्स्ट क्वेश्चन.
Only for taste, ma'am.
No, Meenakshi ji, not only for taste.
For good digestion.
For whose digestion?
Good digestion, मैम इतना ही सुना है अपनी
मैडम. ऑयली फूड
मैम प्रोटीन.
यस, प्रोटीन का डाइजेशन होता है. ऑयली फूड के लिए किरण जी हमारा बाइल है, तो
ओके मैम.
आप अगर प्रोटीन्स जो है हमारे यहाँ पे दाल बिना इसके नहीं खाते कोई भी.
We use them. बिना नींबू के.
बिना घी के या बिना नींबू के नहीं खाते, घी भी उसको पचाता है. अगर घी नहीं है तो नींबू हेल्प करता है. ओके. सो इसलिए इंडियन ट्रेडिशन में आप कभी भी जाओ, कहीं होटल में भी जाओ तो वो आपको नींबू लाके देता है. सो यू शुड डेफिनेटली यूज इट.
Ma'am, what is the use of green chili? We normally eat green chili with our food. So does it also affect our food digestion?
Who is green chilies? कौन से एरिया में? अच्छा चलो ये बता दीजिए मुझे, कौन से एरिया में ग्रीन चिलीज ज्यादा खाते हैं?
राजस्थान.
Ma'am, I think
पंजाब साइड नॉट.
हाँ, नॉर्थ साइड खाते हैं. और
yes.
एक्चुअली लाइक इफ यू विजिट ना
South
नॉर्दर्न
India
साइड,
में
इवन सिक्किम एंड नेपाल साइड, वहां पे वो चिलीज लाके देते हैं एंड यू आर सपोज टू ईट दैट. और आप लोग खा के देखिए क्या होगा उससे, उसके कारण तकलीफ नहीं होगी.
मैम मैं तो वैसे भी ग्रीन चिली खाती हूँ.
हाँ मैम, मेरा भी
I
वही
don't know why,
क्वेश्चन था.
but I love with the
हाँ
food.
मैम, हाँ मेरे को भी ग्रीन चिलीज पसंद है, लेकिन फैमिली में सब लोग बोलते हैं कि ग्रीन चिली नुकसान है, दैट्स व्हाई आई आस्क्ड दिस क्वेश्चन.
नहीं देखिए, एक्चुअली वो हीट बढ़ाती है, इसके कारण जब आप उसको ठंड के वाले प्लेसेस में लेते हो तो तकलीफ नहीं करती है. पर वही अगर आप उसको समर में खा लो तो आपको तकलीफ होगी उसकी. और जिसको अभी आप देखोगे तो ये जो ग्रीन चिली है, इट इज रिलेटेड टू द फायर एलिमेंट. सो फायर आपका कौन से ऑर्गन से? हार्ट एंड स्मॉल इंटेस्टाइन. सो अगर वो भी कम है तो उसको बढ़ाने के लिए, उसका एनर्जी बढ़ाने के लिए यू हैव चिलीज, ग्रीन चिलीज.
तो मैम फिर जब भी हमें अगर किसी को मेनोपॉज की प्रॉब्लम शुरू हो गई तो उसे नहीं खाना चाहिए, पसंद हो तो भी थोड़ा कम करना चाहिए.
ऐसे नहीं है, आप देखिए मतलब पसंद है तो क्या आपको तभी लग रहा है वो खाने की इच्छा हो रही है? क्या आपको हीट बढ़ानी है या कम करनी है? सो हमारे है ना हॉट एंड कोल्ड, यू आर सपोज टू नो what you want and accordingly you have it.
Okay,
So
ma'am.
see, one formula doesn't work for everyone, only it will
Yes,
work in the area. As I said,
Correct.
cold areas it will work.
Correct.
Yeah, ma'am. In Sikkim, actually, they serve boria chili, which is
Yeah. हाँ, खुरसनी
बहुत
मिर्ची
ज्यादा
कहते हैं उसको.
बहुत तेज होती है.
Yes. पर अगर आप ऐसे देखो, ठंडी में अगर दही नहीं जम रहा है, उसमें एक मिर्ची को काट के डाल दो, दही इजीली जम जाता है. हालांकि उसका टेस्ट आता है पर अच्छे से जम जाता है. तो आप इसको करके देखिए कभी.
वो मैम
Okay?
वो आजकल मिर्ची का पानी बनाने को बोलते हैं, जो मिर्ची खाना नहीं पसंद करते, हाफ कट करके ग्लास में रख दो एंड देन गिव दैट वाटर. व्हाट इज दैट नाउ न्यू?
No, I have no idea. Like
I'll
it
share
is
one
just
video with you, then you let me know whether it should apply or not.
sure, definitely.
Ma'am, one thing more, ma'am, protein digestion के लिए we need the acidic material, like you said कि we use the lemon juice for the protein digestion, for the dal
नहीं,
and
वो
all. We
पचाता
always...
है, इसलिए एसिडिक मीडियम ऐसे करके नहीं है, पर वो प्रोटीन्स को पचाता है वो, इसलिए. Okay. चलो come.
Which question paper is this, ma'am?
This is 2021 January to June. This is the color of the lymph is milky due to the presence of what?
Fat.
Inflammation of lymphatic vessel is known as
Lymphangitis.
lymphangitis. And what is adenitis?
Lymphatic node. This is for lymph node.
Lymph node, yes. Then who develops from embryonic mesoderm? Dermis. Yes, it is epidermis. नहीं है, dermis है. Then zones of epidermis are
Ma'am, your screen is not visible. Your screen is not visible.
Is it?
No, it's visible.
It's visible, ma'am.
Okay. Then reticular layer of dermis has how what?
Both adipose tissue and sweat glands.
Yes, both it has adipose tissue and sweat glands. Skin synthesizes what?
Vitamin D3.
Vitamin D.
Percentage of
First of all, आप म्यूट कर दीजिए, बहुत डिस्टरबेंस आ रहा है. We are not able to hear any.
Okay. नहीं, पर फिर सब आंसर कैसे कर पाएंगे? जिसके यहाँ से आवाज आ रहा है ना, वो म्यूट कर लीजिए प्लीज.
मैम आंसर करके स्विच म्यूट करने के लिए बोलो ना मैम
हाँ,
को.
please do that. Then percentage of hemoglobin in blood is how much?
14 plus or minus 1.
14 plus 1 plus minus 1. Please don't answer the A, B, C. Answer what is there, so that everybody understands properly. Then what is the total leukocyte count?
4 to 11,000.
4 to 11,000. Then taste buds are present on the lateral side of the tongue are
Acidic.
acidic. हाँ, खट्टा हमको side से feel होता है. Then olfactory bulb is located where? Nose. Yes. Then the posture of the body is maintained by
Vestibular apparatus.
And what does the cochlea do?
Cochlea or also do the balancing.
No.
Ma'am, both vestibular and the cochlea both do the balancing.
Cochlea, it transfer the sound waves. Okay.
Yes.
So it transfers basically sound waves to the temporal lobe. Then who's related to the eyes? Aqueous humor, vitreous humor, or both? None?
Vitreous humor, ma'am.
Both. Aqueous आगे है, vitreous पीछे है. The lens of our eye is
Biconcave.
biconvex. Yeah, biconcave.
Ma'am, concave.
Yes. And what is hypermetropia?
Hypometropia is correct by biconvex.
No, but what is hypermetropia? Tell me first that.
We cannot see the distance.
No,
We cannot see the
that is
distance of the
myopia.
object.
When you can't see the distant object, it is myopia.
Oh, okay, sorry. Hypometropia, we cannot see the near object.
Yes, the near objects are blurred. And what is the normal vision known as?
Hemetropia.
What?
Hemetropia.
Hemetropia, yes. Then glossopharyngeal nerve is related to?
Tongue.
Yes. Wherever the glosso comes, it is tongue. Cochlea is the part of?
Ear.
Ear. Who increases the heart rate?
Sympathetic nervous system.
Sympathetic nervous system.
Yes. And spinal cord segment, which nerve innervates heart?
T1 to T5.
Yes, T1 to T5. Ciliary muscles are related to?
Eyes.
What does ciliary muscle do to the eyes?
That hold the lens.
Yes, so lens को कम ज़्यादा बढ़ाना है, कम करना है, वो सब करेगा. Then inner portion of the brain is made up of?
White matter.
Yes, बाहर में आप ऐसे सोचिए, काला बाल बाहर है, तो gray matter is outside and inside is the white matter. Then cerebral cortex is the part of?
Brain.
Now diencephalon, it takes part in the development of?
Both.
Thalamus and the hypothalamus.
Yes. Now if we see here, one moment, I would just like to show you this. So now if you see here, this is prosencephalon. This is in the forebrain. Now it divides into talon and
Talencephalon and the
diencephalon. Now this will develop the two lateral cavities. Okay, the lateral cavities will be developed by this telencephalon. And the diencephalon, what it will do? It will develop the thalamus and hypothalamus. Okay, and then it will, there is, next one is the mesencephalon, prosencephalon, mesencephalon. Now this mesencephalon, what it will do? This will produce the midbrain from the tectum. And the last one is the rhombencephalon from the hindbrain. Rhomben. Now what it will develop?
Pons and medulla.
So it will have metencephalon and myelencephalon. And meten will develop what? It will develop pons. And this will develop medulla. Okay, so you'll just write down this. So prosencephalon, mesencephalon, rhombencephalon. This is the forebrain. This is the midbrain. And this is the hindbrain. Okay. Now come to the pons. Pons is developed by whom? Metencephalon. Then sulci and gyri are related to?
Cerebral cortex.
Cerebral cortex. The weight of the brain of an adult person is?
1400 grams.
And how much is the weight of the brain inside?
50 grams.
50 grams. And who floats in cerebrospinal fluid?
Brain.
Then sensory nerves are
Afferent.
afferent. Then who brings orders?
Motor nerves.
Motor nerves. Yes, sensory nerves carry the sensation. Motor nerves brings all the orders. Then these are related to thirst. Who is related to thirst?
Hypothalamus.
Osmoreceptors. Then hypothalamus controls what?
Both limbic system and endocrine.
Yes. Then who is a member of the limbic system?
All.
All of them. Yes, hippocampus, septal nucleus, epithalamus. Then who dampens the over impulses sent by the cerebral cortex?
Cerebellum.
Cerebellum? Yes. Then who is related to cerebellum? Dysmetria, ataxia, or both?
Both.
What is dysmetria?
He is not able to calculate the distance between the.
Yes, he cannot calculate the distance. And what is ataxia?
Ma'am, please explain what is this material?
He cannot calculate the distance. Okay. Abhi, I have to climb the staircase. How much foot should be lifted up? I cannot calculate the distance. That is dysmetria. And what is ataxia? It is loss of synchronization. Okay. The next one, parts of the brainstem are
All.
Yes. Then salivary center is present where?
Medulla.
Type of motor tracts are
Both.
Yes, pyramidal and extrapyramidal. Okay, both of them are descending tracts. Then how much are the extrapyramidal tracts?
6, ma'am.
6. Then muscles that help in the flexion of elbow joint are flexion, closing by biceps. What is the 10th cranial nerve?
Vagus.
Then hypoglossal is related to tongue. Then special external receptors are
All.
Yes, vision, auditory, smell. Then member of the central nervous system is
Both.
brain and spinal cord. Then nerve cells are incapable of doing what? Reproduction. Yes. Then properties of the skeletal muscles are all. Then it is necessary for contraction of the in bone muscles.
Energy and stimuli both.
Yes. Then coming to the next one, muscles help in abduction are
Abduction group.
abduction group. Abduction means to take away from the midline. So when I'm lifting my hand from the side, this is abduction. Similarly with my leg also. Then what is the unit of nervous system? Neuron. Then what is the function of the bone?
Protection.
Both. It gives shape also and it will protect you also. The number of bones in the lumbar region are
5.
And carpals are present where?
Wrist.
Upper arm.
Wrist. Upper arm. No, upper arm is this. Okay, this is upper arm, this is forearm, and the carpal bones are here in the wrist. Okay, good. So we have completed this question paper. Wishing you all the best. I'm sure you all will do very well.
Ma'am, thank you very much.
Thank you,
It was
Thank you
very
so much, ma'am.
interesting. Ma'am, our request is, if possible, take a blood one after exams, please.
Yes. Do that.
Yes, ma'am. Please take some more classes.
Yes, we'll do that.
See, by mistake, I have, forget to introduce our beloved faculty, Dr. Nilima Patil. Though she is very well known throughout the country because of she is a very good upcoming faculty. Within last 3 years, I have seen her growing with a rapid speed. Whenever she takes any class, she is a very versatile teacher. She has got very deep knowledge, not only on BHP, but also on TCM as well as on Ayurvedic acupuncture. And another main, characteristic features of Dr. Nilima Patil is she is another, budding Kemkaji, I should say, because she also operates from giving domain. She is also like an ATM. Anytime we can draw money, no, like that. Anytime she'll come to our rescue or to help us. A fantastic personality, and our Samsthan and Ishan and all of you are really privileged to have such wonderful souls amidst us to tutor us. I thank her very much for today's
Thank you
session.
so much, sir.
And friends, if I am planning to conduct some extra, courses to empower properly to increase your confidence and clarity on the subject, and all our faculty like Dr. Nilima Patil, Lakshmana Krishnamurthy, Sangeeta Barmanji, Chanchalji, A.P. Jain, and many people are coming forward. We'll take use of their services, and please attend these extra classes which are notified in all Ishan groups. It is open for everybody. Okay? And today at 8 o'clock, we have another important session by Krishnamurthy Lakshmana on treatise 2. What are the types of energy, what are the types of diseases, everything will be discussed. See, today, Madam has told you two important points like SP8, which is called constructive kick energy point of the whole body. It controls the sphincter of the urinary bladder. It is the Ezekiel point of the spleen meridian. Fantastic point. If you just stimulate that, so many problems can be solved. Even UB54 is, what you call earth point of the urinary bladder meridian. Earth will suck the energy from mother, that is fire. That's why excess heat from the whole body can be removed. Any disease can be treated related to skin by treating that point. Just 1 or 2 points only she is referred. All of them are extremely, proven point. Minimum point, maximum benefit you will get. One of the best faculties we have in our Samsthan is our Dr. Nilima ji. So friends, we'll again catch up today for the last revision class of this season at 8 o'clock on the same Zoom ID. I thank Nilima Patil once again for the wonderful session.
Thank you so much, sir.
मैम कैन वी गेट योर नंबर
Thank you very much, ma'am.
मैम आपका नंबर चाहिए मुझे प्लीज आप एक बार
I'll
लिखेंगे
write down in the chat. I'll write down.
Thank you, Nilima ji. Wonderful session.
Thank you.
Yeah, ma'am.
Thank you, sir.
Nilima ji, will you be able to just give suggestions for 5th semester BHPA tomorrow at any time if we contact personally? Is it possible? I'm Mangalam. Hope you remember me.
Yeah. You were there
Very
for the
kind
4th
of you.
semester.
Yeah. Is it possible tomorrow anytime? Will you be busy?
Actually, I am. Let's you talk to me on the personal chat, and then we'll decide if it's
Thank you
possible.
so much. Thank you so much. Gratitude.
Okay,
We'll
sir.
close
Close the session. Yes. Thank you so much, sir.
Good night.
Thank you
so much. Thank you, ma'am. Thank you, sir.